today about this very important subject. And I'm honored to speak on behalf of the hundreds of thousands of employers, employees, and family members who are represented by the Hampton Roads Chamber. Look, we all know that hospitals are a critical component of our economy. They're certainly very critical to our region in Hampton Roads, not only for the care that they provide to our citizens and workforce, but also because of the jobs they create and the contributions to our economy. The healthcare industry is one of the largest economic sectors in Hampton Roads. Our health systems rank among our top employers. That's why they're so important to our economy in Hampton Roads. They contribute more than $25 billion in community benefit to our region and employ more than 23,000 people in our healthcare system in Hampton Roads. The latest Hampton Roads State of the Region report from Old Dominion University, we contract every year with Old Dominion University Economic Department to do what we call a State of the Region. The State Chamber is doing a State of the Commonwealth now with the same organization. But what they stated last year, that between 2007 and 2015, the healthcare sector by far added the most jobs in our region. More than 16,500 new jobs during that time period. I don't know of any other industry that can claim those type of statistics. And in the coming years, the United States Bureau of Labor Statistics projects that healthcare sector will account for a major share of our nation's job growth. In fact, across the Commonwealth, our community hospitals and health systems support over 115,000 jobs, contribute $36 billion in economic activity, and spend $17 billion in goods and services with local businesses. I think that's all depicted on the chart here to my right, your left. But here's my point. We should be extremely cautious on a state policy level about doing anything that could negatively impact these vital services, their providers, in our economy. As you heard the prior speakers, let's do no harm with state policy. That's why I'm speaking with you today. The role of the Chamber of Commerce is to set the conditions in the community so that businesses can be successful. And if businesses are successful in our communities, they're creating more jobs. Setting those same conditions also incentivizes other businesses to relocate to our communities. And it's been my experience over the years that when you talk to these relocation or site selection experts, one of the first questions that they always ask is, how is the healthcare system? They want to know if there's a readily and talented workforce there, great school system, and healthcare system. I can assure you those are the three primary things that these site selection experts are looking for. They just don't want to move to an area where they can't have a good healthcare system for their employees. Those questions are easy to answer for me now because Virginia is blessed. We're truly blessed with a high-quality network of local hospitals and health systems, especially in Hampton Roads, where we are blessed with many exceptional healthcare systems, including Chesapeake Regional, CHKD, Bon Secours, Riverside, Centera, and other hospital providers. Additionally, as most of you know, Hampton Roads is a proud military community. In my first career, this is my third career now. In my first career, I had the distinct honor of serving in the United States Army, and I spent quite a bit of time in the Army deploying around the world, and I had many joint operations with other services. And I can tell you that one common thread among all of our military is the importance of taking care of our soldiers, sailors, airmen, Marines, and Coast Guardmen. Here in Virginia, our hospitals provide exceptional care to civilians and men and women in service to our nation. Last spring, for example, 8 sailors were wounded during a mishap on a flight deck on an aircraft carrier docked in Norfolk. While some of the sailors were treated by the military, several were flown to one of our local hospitals for professional care. That's just one example of the important work our hospitals do each day. We can't afford policies that would harm our healthcare system or their providers. That's why in Hampton Roads, the Hampton Roads Chamber and other local regional chambers, both large and small across Virginia and several localities to include the city of Virginia Beach, have endorsed resolutions and taken formal positions affirming the importance of COPN and opposing COPN repeal efforts. The chart to my left, I think, shows the many chambers and municipalities who firmly believe in what we're talking about here today and have taken a position saying so. Finally, as a business leader, I believe in the free market. We preach it and we support it every single day. But an honest discussion of COPN requires an open acknowledgement that healthcare simply is not a free market because the rules that our government has placed upon it. It's just not. It's not a free market. A free market system requires a level playing field, and we don't have a level playing field here. Additionally, repealing COPN would make an already uneven playing field even more slanted, and that concerns the business community. As many of you know, Hampton Roads has some hospitals that are financially stable and some hospitals, quite frankly, that face real financial pressures due to years' worth of government decisions and government mandates. These challenges certainly are not exclusive to our region. They have been documented in places around the Commonwealth. So as the Hampton Roads region and the Commonwealth as a whole grapple with both short-term and potential long-term impacts of the federal deficit and what we're going to do with the ACA, we should do everything we can to support the critical economic sector of healthcare and not jeopardize it. Let's do no harm. Strong, stable hospitals are vital to public health, they're vital to our economy, and they're vital to the prosperity of the Commonwealth of Virginia. In that regard, it is our opinion, our strong opinion, that significant deregulation of COPN or outright repeal without first taking the time to review the potential impacts on access to care, the impact on our hospitals, the impact on our economy, would have devastating impact on not only the Hampton Roads region, but the Commonwealth as a whole. Ladies and gentlemen, I thank you very much for coming and listening to me today. Thank you.